It was freshman year of college, and I found myself in Hawaii attending the University of Hawaii at Manoa, studying architecture. I had been pretty sure that architecture was what I had wanted to do with my life, but only pretty sure. There was an inkling of a sense of unfulfillment that I couldn't get away from at the same time, and it only took one special conversation for me to put down my drafting tools.
Hey, we have to talk. I've been meaning to talk to you about it for a while. It's just...
Oh, about what? Whatever it is, I didn't do it.
No, really, this isn't easy.
Oh, okay. It's alright, you can tell me.
I have hepatitis B.
Oh, alright. When did you get it? That's okay, it'll probably clear up in a few months, right? Have you been to the doctors?
No, yeah, but no, I've had it for my whole life. I was born with chronic hepatitis B. My mom also has it, and I got it from her while being born.
I see. Well, are you okay?
I guess right now, but no, not really. It's hard, both physically and mentally. It's like there's this thing inside me that'll probably end up being the cause of my death somehow, like this evil ticking time bomb that I can't get rid of. And sometimes, if I think about that too much, it really gets to me. I lose a lot of sleep over it. And just also in general, I just feel really dirty, that I'm a walking health hazard. I feel selfish being around my little cousins as I want to spend time with them so badly, but at the same time, I feel like I'm just putting their lives in danger.
I mean, they're probably vaccinated, right?
Still, no vaccine is 100% effective, and what if I make them into a statistic? It's all just really hard, and then there's you, and I feel selfish here again. I just want to say sorry.
Sorry? Sorry for what? Don't be sorry. I'm sorry that you've had to go through this and that you haven't told me. Hey though, it's okay. I mean, I know it's a big deal, but at the same time, no big deal, okay? I know you have a doctor's appointment coming up soon, yeah? You said it's just a yearly checkup, but I'm guessing it also has to do with all this, right?
Yeah.
Let me go with you, if you don't mind. This doesn't have to be something you have to hide or feel ashamed about. Then maybe I can learn about the virus and stuff a bit too.
Yeah, that'd be really nice. I brought a friend with me today. He's come to learn a little bit more about what's going on with me and what hepatitis B is.
Okay, well, all of your vitals seem to be on par right now, judging by the nurse's report. We'll run your blood work and let you know when we get the results back then. As for the information pertaining to the Hep B virus, I can tell you some general information. Most importantly, regarding you personally, transmission of hepatitis B occurs through infected bodily fluids and blood, and it usually infects the liver. The virus can be spread via dirty needles. Tattooing and acupuncture in the 1980s caused a surge in the number of cases of HBV. Also, as a baby, as was her case, has a chance of being infected if that baby's mother has hepatitis B during delivery.
Oh, okay. Well, what would I experience if I do get infected? Also, what's the difference between acute and chronic hepatitis B?
Well, most of those with the acute infection are initially asymptomatic, but you can develop symptoms within a few months, such as vomiting, fatigue, dark urine, and jaundice. In most cases, the infected individual's condition improves within a couple weeks, and death is unlikely and would be from hepatic failure. The entire infection can be entirely asymptomatic and often go unrecognized. Those who contract Hep B near the time of birth, like in her case, however, have a 90% chance of developing a chronic infection, which may also be asymptomatic or a result of chronic liver inflammation, which can lead to cirrhosis in a couple of years. This makes it more likely for the patient to develop liver cancer. However, just like the acute form, most of a chronic infection of HBV also stay asymptomatic.
Well, if the infection's usually asymptomatic, how do I know if I've been infected?
You can be diagnosed 1 to 2 months after you think you've had an exposure. So if you do experience some of these symptoms and believe you may have become infected, you can come in for a visit and we will test your blood for antibodies and parts of the virus such as surface antigens. I suggest you do some online research to learn more about the virus itself too. But have you been vaccinated?
Yeah, I got the hepatitis B vaccination as a child.
That's good. It's a recommended vaccine by the World Health Organization, and it has a 95% efficacy. Did you get the 2 or 3 required boosters as well?
Yeah, I believe so.
Then you shouldn't have a problem. Anyway, we'll see you both in 6 months to recheck her blood levels. That's if she decides to keep you around.
I wish there was something more that I could do. I hate seeing her suffer like this, and that she said sorry to me for it. I don't want to be just someone who takes her to the doctor's office. Maybe instead of taking her to see help, I'll be the help. I'll be a doctor. I'll go through a great pre-med program and head to an amazing med school program. I'll be her doctor. But wait, she has a doctor, and there's many doctors, yet she's still suffering from it. And all they say to her is, we'll check your levels and we'll see you in 6 months. And then she goes home, still infected. I don't want to be the one to tell her that. That's living with a problem, not a solution to it. I want to do more than that. I want to cure her. That's it. I want to find a cure for her and others like her to make her better, and to hopefully stop someone from having to have the same kind of conversation that we had to have. I'll become a virologist. Tomorrow, I'll start with what the doctor prescribed to me, a nice search on YouTube to find more information.
Hepatitis B is caused by the hepatotrophic hepatitis B virus, HBV. HBV is a hepatinovirus. It has an envelope, an icosahedral capsid that encloses its partially double-stranded genome and packages a reverse transcriptase. It is also one of the smallest enveloped animal viruses. On the outer envelope of the virus, there are proteins that are involved in binding and entry. The virions that infect the hepatocytes are called Dane particles, but there are also non-infectious particles that also express the same surface antigens as Dane particles. A lot of these non-infectious particles are produced during the virus's life cycle and are found in the host's serum, a common target for diagnostic tools. The HBV virus enters the cell through endocytosis. As it travels towards the nucleus, the core is disintegrated and the DNA and viral polymerase are released, which travel through a nuclear pore into the nucleus. When the genome enters the nucleus, it is circular and partially double-stranded. Host enzymes then complete the partially formed positive strand DNA and close the circle, creating a covalently closed circular DNA, also known as cccDNA. Viral mRNA is made by host DDRP and moves into the cytoplasm. Some of the mRNA will be translated, making viral proteins to form the core and viral polymerase. Other pregenomic mRNA will be packaged into the new virion, where viral reverse transcriptase will synthesize the full negative strand and the partial positive strand. In the ER, the viral glycoproteins attach and the viruses exit the cell by budding and is ready to infect other liver cells. The virus causes liver disease primarily by replicating in hepatocytes. Most of the injury to the liver is caused by host adaptive immune response by cytotoxic T cells trying to clear the virus. They produce antiviral cytokines causing liver tissue damage. Here's an interesting fact. Hepatitis D is a defective virus that uses hepatitis B's surface antigens, so it requires a hepatitis B co-infection for its own replication. Thus, hepatitis B can act as a helper virus for hepatitis D.
The first epidemic was in 1885 in Bremen, Germany, where needles contaminated with HBV were used for smallpox vaccination. These people became sick with jaundice, while those who received the vaccine from a different batch did not. Similar reusing of contaminated needles for vaccination caused other HBV outbreaks through history. The virus particle itself was not discovered until 1970 by D.S. Dane through electron microscopy and named the infectious particles after himself as Dane particles. Today, World Hepatitis Day is observed on July 28th in an effort to prevent hepatitis A, B, and C by raising awareness. Currently, approximately 240 million people have chronic hepatitis B, and more than 780,000 people die every year from hepatitis B, causing diseases such as cirrhosis and liver cancer. It is important to know the risks of hepatitis B. Vaccinate children early, only use sterile single-use needles for injections, get tested, and seek treatment.
In endemic areas such as East Africa and Sub-Saharan Africa, infection around the time of birth due to contact with infected blood or from the mother during childbirth is the most frequent method of contracting HBV. However, in areas like the United States, where the disease is not endemic, infection through unsterilized needles and infected body fluid is more common. Treatment. Even though there is an effective vaccine for HPV, around 1 in 3 people worldwide still get infected with the virus, and it causes approximately 1 million deaths each year. For acute hepatitis B, supportive care is the only treatment used currently. For chronic hepatitis B, antivirals and interferon-based therapies are used to reduce the damage caused by the virus. There have been cases in which drug treatment eradicated the virus from the patient completely, but this is an extremely rare therapeutic outcome.
A few years later, I'm on my way of fulfilling my dream of becoming a virologist. I'm excited to eventually obtain a PhD and start my own research on hepatitis B. When people look up information online and see that 240 million people in the world are currently suffering from chronic hepatitis B, they don't necessarily always think about what that means. That potentially there had to be 240 million similar conversations like the one she shared with me. 240 million people possibly living with the same mental burdens that the disease is causing that special girl in Hawaii, which isn't even mentioned as a symptom of the infection on WebMD, but is every bit as debilitating. And this is just one virus. There's a ton out there that don't mind calling your body home for your whole life, in which we have nothing currently to get rid of them with. Her and the other 240 million chronic hepatitis B sufferers are like little embers that all bunched up inside of me to create this fiery passion that I have to hopefully make a big difference in her world and worlds like hers.